Ashish Dongare, who's the Ratan Tata Postdoctoral Fellow at the III. He'll be speaking to us for about 40 minutes or so on the topic of the multidimensional index for assessment of social protection framework, a life cycle approach. And I should also mention that next week we're very happy to have Paul Segal and Marion Lietov giving a seminar next week, so we hope to see you there. Ashish would prefer questions at the end unless they're very urgent clarification questions. So thanks, and with that, over to you.
Very good afternoon, everyone. Thank you so much, Professor Francisco, for introducing me and giving me an opportunity to present my ongoing work here in front of this audience. So this present work is basically about measuring conceptualization and construction of a measuring tool for the assessment of the social protection index. So basically this study is being divided into two parts. In the first part, I will be discussing the construction and conceptualization of the index, the proposed index. And in the second part, we will be looking at the practical applicability of this index in the Indian context. So accordingly, this accordingly, this presentation particularly has been framed in the first part. As I mentioned, we'll be talking about the introduction, wherein we'll be seeing what's the rationale behind this study, why this particular study has been taken up. Then again, conceptualization and construction, and then we'll be looking at the practical applicability and sensitivity with respect to the to check the robustness will also be discussed. As we know that inequality exists everywhere across the world. As per this World Inequality Report 2022, if we see globally, the income, the bottom 50% of the population has contribution to the income only 8.5%, whereas the top 10% has the contribution of around 52%. When it comes to the ownership of the wealth, we only 2% of the wealth is being actually owned by the bottom 50% of the population, whereas 76% of the wealth is being owned by the around only top 10% of the population. Apart from that, there is a varied and variation in the demographic composition also, particularly in the developing country, wherein you will find the and across world also now the population is now aging, population is increasing day by day. So these are all the things which actually make us think what is that which can actually help us in eradicating poverty, bringing equality into the society. And if we see one of the key instruments to address this inequality, poverty, or the social exclusion problem is the providing the social protection. So if we see social protection, it has this various components or various ways of it, like it's broadly understood as social insurance, sometimes social assistance, labor market policies. All these comprises of social protection, and it plays a very vital role to protect people from the adverse market effect and the life cycle contingency. So this has a very important role in actually bringing the equalities in the society, and that's the reason why in Sustainable Development Goals, social protection has been included. And if we see particularly the target for that is also has been set up, the SDG 1, which talks about removal of the poverty. There the target for the social protection has been set up as per, and the target 1.3, what they called is to implement the nationally appropriate social protection system and measures for all by 2030. So this is the target which has been set up in order to promote the social protection across the globe. Similarly, target SDG target 3.8 also talks about social protection in a way, because it's about the providing universal health coverage to all. So again, it's a part of the sort of a social protection which is to be extended across the globe. So with this increasing importance of the social protection, it's very important to understand where exactly now the social protection stands in terms of its coverage, in terms of its adequacy. And that's the reason why this study has been taken up. If we see this ILO's report 2022, according to that, only around 47% of the population has now at least one type of social protection which has been extended. So there is a huge gap in terms of the coverage of the social protection globally. If we see worldwide, there is again a disparity in terms of the social protection coverage. Whereas worldwide on an average is around 45% to 47%. If we look at Central and South Asia and Sub-Saharan Africa, the percentage is abysmally low. It's around 16% and 13% only the population has been covered, which triggered the importance and necessity of having social protection systems in place. So, this is why we need a framework wherein we can have a robust framework which can help us in combating with the inequality, poverty, and social exclusion. And one important thing about the social protection programs is that it's not one thing, it cannot be evaluated or seen in isolation. When we talk about the social protection, it has to be seen comprehensively, and it has to be assessed comprehensively. Because if one department is running one program and other department is running other program of the government's department, I'm talking about. So in that case, if there is no synergy amongst the department, then the entire purpose or the target gets defeated. So that's why when we talk about the social protection, the comprehensive assessment is very much important, and more importantly, their outcomes are quite also interlinked. If there is a livelihood program, social protection programs, to some extent, it also helps in getting the people education or getting the people their health access also. So that way, a holistic assessment of the social security framework is very, very important. And that's why this particular topic of having a measurement tool for assessment of the social security program has been taken up. There are, again, there is a lot of literature available on the indices and these social protection aspects also. A few has been listed over here. Particularly this ADB's technical assistant report, which is being which talks about this social protection index. They also actually proposed in 2005, but that's like a very unitary approach they have taken in terms of the coverage only. Again, there are other indices also which has been criticized, like this multidimensional poverty index or HDI, which is being criticized and which is being studied by many researchers and academicians. Again, Art working paper work is also there, wherein he talks about the human capital index, and the methodology is being given basis on the 3 dimensions of the human capital. So these are the list of studies which I have highlighted over here, and particularly for this, even the reports of the on the various indices has been taken into account. Like Mercer has come up with the report on global pension index, which has been now for last, and they evaluate around 56 pension system across the world. And that index particularly have taken when it for deriving the dimensions of this social protection index. So these are the few studies which have been highlighted, but what I have observed during going through this literature is that there is a very limited literature regarding the assessment of the social protection programs, and hence this study, this motivation of doing this study has been come up. So in sum, the objective of this research study is to conceptualize a multidimensional index for social protection framework. Second objective is to define the methodology for constructing such index using the life cycle approach. The life cycle approach has been taken, reason being when it comes to the social protection, the life stages, each life stage of any human requires certain particular program to address their need of that particular life stage. So that's why the life cycle approach has been taken. Third is to check the robustness of this index, and this index I am proposing to call as a multidimensional social protection index, MSPI. And for that, a comparative study between various Indian states in India has been carried out in this particular study. So let's see about the conceptualization of this index. As I was mentioning, this is about the life cycle approach. And if we see, the life cycle of any human being, can be divided into three major stages. One is young, second is adult, and third one is elderly. Again, for the purpose, because throughout the life cycle phase, in these three life cycle phase also, there are multiple stages. So for the purpose of computing this index, I have divided this each stage into further into two parts. For example, young stage I have divided as early childhood, which comprises of from 0 to 6 years, and then childhood from 7 to 14 years. In case of second phase, it's again divided as a young adult, which is from 14 to 40 years, and then adult as 40 to 59, 60 years. And for elderly also, there are two phases, elderly and old and very old. So this is for the purpose of, we'll see when I'll be doing that, I'll be talking about the mapping, how these life cycle stages are relevant. Yeah. So on the basis of these three life cycle, on the basis of three major broader stages of the life cycle, the index has been also been divided into three segments, into three sub-indices. One for the young life cycle phase, it's called as a young social protection index. That sub-index. Second one is for adult phase, that is adult social protection index. And for elderly, there is the elderly social protection index is being given. And we know that at each stage of this life cycle, as I mentioned, the domain area, the area in which the social protection requires gets different. So, for example, in young age, the important thing is education and health. Similarly, in adult and this older age, the protecting the life cycle, protecting this livelihood is more important, because they are the bread earner for their family, and if livelihood gets protected, the entire family in a way gets that protection. So similarly, and health is the subject which is being like right from the birth to the end of the life is very important. So that is taken as the another domain. So this is actually classification on the basis of classification of the sub indices and the domain which are pertaining to particular that life index. Third important aspect of this is the dimensions. By dimensions, I mean the area or the area on which we need to evaluate any social protection program. If we need to see whether the social protection program is successful enough or good enough, in that case, we need to see firstly whether that program is adequate enough or not. So by adequacy, I mean whether the level of entitlement or the benefit which that program is delivering is good enough to take care of the livelihood, if that program is intended to provide the livelihood. Health coverage, if that program is intended to give the health benefit or health access to the family. So that's why adequacy is the one important dimensions which we need to look at while evaluating a social protection programs. Second is the coverage. This coverage means it's by name itself, it's it indicates that it's about what proportion of the eligible population is covered by that program. So this is the second aspect which we need to look into while evaluating the social protection program. And third aspect is that efficacy. Efficacy means, if I go by the dictionary, means it says that it's ability to generate the desired results. So what that program is having, whether that program is in a position to deliver the intended results or not, that has to be judged, and basis on which we can actually judge the efficacy of that program. So if when we evaluate all three dimensions together, then only we can say that we have actually assessed that program completely or comprehensively. So these are the three dimensions of the program, and this three dimension S I am calling it as for evaluating the social protection program, ACE, adequacy, coverage and efficacy. All putting all these things together, if we see this social protection, multidimensional social protection index based on the life cycle approach will look like this. At the top, there is this social protection index, which is the major index, which is then decomposed into the three multidimensional sub-indices. Then for each sub-indices, there are two life cycle stages are classified, and for each life cycle phase, their domains are defined. So, and all this, each scheme pertaining to each of these domain with and respective respective sub-indices will be then evaluated in all three dimensional dimensions, that is adequacy, coverage and efficacy. And to judge, to gauge these dimensions, the indicators need to be curated. And that's like here I am indicating this by Y1 DO1 ACE. It means that Y1 is this life cycle phase of early childhood, young life cycle phase 1. DO is domain 1 for education, and ACE means indicator for adequacy for this particular scheme, which is meant for early childhood and protecting education. So likewise, this adequacy, coverage and efficacy indicators need to be curated for each of the scheme to evaluate the social protection programs. So this is how this index flow chart is, and it will look like when it for the at conceptual level. Now we are moving to the second part of this, that's about the construction of this multidimensional social protection index. The methodology is quite simple. At the very first step, we will be like mapping various schemes of the social protection in that particular direction in the LCDO matrix. LCDO matrix is the life cycle and domain matrix. So here, for example, the scheme is made for the life cycle phase 1, and it's representing the domain 1, that's for education here. Then that scheme needs to be put in this particular bracket. Similarly, if that phase is towards the end of the life, meant for the old age, and it's providing the livelihood, then it has to be mapped at DO3 under life cycle phase 3. So this will help us in identifying the schemes so that even we can government or policymakers can look at if there is a multiple schemes or if there is overlapping, they can look into it and they can see whether this that particular scheme is to be kept or even can be removed. But that's the secondary thing. The first thing, that the matrix for the evaluation purpose or for arriving at a score of the index, this particular index, we are doing first in mapping. And second, at the second stage, we are actually creating the indicators for each of the dimension. Here I have given some indicative indicators for measuring the various dimensions. For example, adequacy. In case of education, the indicator will be like number of elementary schooling, because that's minimum schooling that any citizen should require. And in many developing countries, getting the elementary education like from class 1 to class 8 is also not adequately done. So whether that social protection program is covering at least the elementary education or not would be like indicator 1. In case of health, we'll see whether that the hospitalization expenditure has been covered to what extent. So this will be like second in terms of measuring the adequacy. And if we need to measure the livelihood adequacy, in that case, we'll see the income support provided that particular program is adequate enough to match up the average consumption expenditure of an individual or not. And for coverage and efficacy, the indicators, the broader indicators would be throughout this, any domain will remain same, like beneficiaries of the program as a proportion of the eligible population. So to what extent the eligible population or intended population, targeted population is covered will give us, will tell us about the coverage aspect. And efficacy is about how much fund actually there are many ways to evaluate efficacy, but here what I am using is the utilization of the fund, whether that fund released by the government has been utilized to the maximum extent or not, will tell us whether that program is in a position to deliver the desired results or not. So these are the indicative broader indicative indicators for evaluating the various dimensions. In the third step, because in the second step, what we are seeing, the indicators are basically the ratios or the proportion. And in that case, when we, for the purpose of simplification and the computation of the index, we are just converting that. The third step, we are just converting it into the percentage term to see into percentage. And in stage 4, what we are doing is the each indicator which is initialized at 100%, and then we are transforming it into 0 to 10 scale with this equation. If that value of that is calculated indicator is more than 100%, then we are taking it at 10. And if it's anything below 100%, we are taking it and we are dividing it by 10 so as to get the indicator value. Then in the next step, we are aggregating this each indicator's value, adequacy indicator, coverage indicator, and efficacy indicator for each of the scheme, and we'll get the value of the scheme at a scheme which is representing life cycle stage L and domain O. So this will be the value of the scheme, value of the each particular scheme. And at step 6, what we are doing, we are actually again aggregating the entire number of schemes which are representing the particular index. So all three indices then will be aggregate. Every scheme of each of these indices will be sub-indices will be aggregated to arrive at the value of each sub-index, and which at the last stage will be given the weightage of the population of the respective age group. Means, for example, if the young population is like 30% of the overall population, then the weightage of that young social protection index will be 30%. And if accordingly, the weightage will be assigned to each of these sub-indices. And finally, the summation of all this will give us the final score. So this is how we'll be arriving at the final score of this multidimensional social protection index. In the second part, this is how this conceptualization construction of index happen. Now I'm just going through the details of when we apply this to few schemes which are majorly flagship schemes in India, representing each of the domain, how this MSPI score looks like, and where all states in India stands. So this is basically the application of this index in the Indian context. Before that, just I would like to throw some light on the demographic conditions at the in Indian context. As we see, as you all know, that Indian median age is around 29 years, and that's the reason if you can, the young population is comparatively higher than the old population. But still, there are few states like Kerala, wherein this older population is higher as compared to the other states. Again, this red line is indicating the last two poor quintile of the population. and there is again a wide there is a quite variation in that also. There are few states like Assam, then Bihar, and even this Jharkhand, where you will find the last two quantile of the population is more than 50%, whereas there are few states like Delhi and Kerala where the last two quantile population is very low. So this is required to see which in which state what are my target population or a population where I need to design my social protection programs. So, and even this yellow line is indicating the household size, which is also again there is a variation. If we see on an average, the Indian household size is around 4.8 as per the census 2011, but there is also wide variation. Like in Jharkhand, it's around 5.4. In Jammu and Kashmir, it's around 5.7. But if you see the state like Tamil Nadu, it's around 3.7. 3.7 household size is around 3.5. Yeah. So,
sorry, just to remember, the cutoff between childhood and adult is 15. Age.
Yeah.
Age 15.
So that's actually because there's old age dependency also in many cases is calculated from 15 and above is considered as a working population. So that's the logic I have taken to have that cutoff. But in countries like that can be extended to 18 years old. So that was the dilemma even I was facing. But then I thought because the old age dependency is calculated from 15 to 60 in case of India also. So that's the reason I have taken that as a cutoff. So this is just a snapshot about the demography that India is now having. And just to throw some light on the social protection landscape for India. So India we have many social protection programs which can be classified as a social assistance program, social insurance, and labor market programs. And these are the few schemes like integrated child development scheme, mid-day meal, IGNOPS, and all these schemes which are the part of the social assistance program. We have some social insurance program also like Atal Pension Yojana, Pradhan Mantri, this Suraksha. This is like accidental insurance and even life insurance parts also has been extended by this particular government to the entire population. And we also have some labor market programs like Manrega, I think, which is the mostly studied scheme across the globe, and all of you might be knowing about it. And we also have some national urban livelihood mission, which also provides some labor market, some assistance in terms of the livelihood to the urban workers. Also, they have some skill development programs. So these are the many programs, but because the considering the time limitation and limitation of this particular study, I have considered these 5 schemes representing each of the which are catered to the different life cycle stages and also across different domains, so that matrix 1/6, this matrix 3/6 matrix can be completed. That was my purpose, and I have selected these 5 schemes. First scheme is integrated child development scheme, which is actually world's largest unique program for early childhood care and development. These schemes offer the supplementary nutrition and also preschool education also. Midday meal program also is about providing the nutrition food and to help student to attend the school. Thing is that in case of education in India, now after 2009 we have this Right to Education Act, which covers the complete elementary education from class 1 to class 8, and that's the reason that's become the part of the social policy, I would say. And hence for the purpose of evaluation here, under the education, I have taken these 2 schemes, this particular scheme, midday meal scheme, because though it's for providing the nutrition, but it helps students to come to school, and that's how it's not about enrolling the school, but it's about attending the school also. So that's why, in a way, it supports the primary and upper primary classes. The attainment in these classes increases because of this program. So that's the reason this program has been taken. And this Manrega, These programs provide at least guarantees at least 100 days of employment in every financial year to the rural household, and this is categorized under livelihood. Similarly, recently in 2018, Government of India launched this Pradhan Mantri Jan Arogya Yojana. This is basically the health insurance scheme, and it's considered as the world's largest health insurance scheme because it's intended to cover around 40 crore of the population initially, but then again state also added some, and now it's around 50 crore of the population is intended to cover under this particular program. And lastly is this IGNOPS, this National Old Age Pension Scheme. This is for the old age population, and it covers, it actually gives very minimal amount, but then this is again a long run scheme in Indian context to provide social protection to the old age people. So going by the steps that we had, here in the first step, as we need to define, we need to map the various schemes in this LCDO matrix. Here ICD as the scheme for children is classified in this particular first cell because it's representing the childhood, and also it's representing the domain area called education. And this in DO2, this health scheme is across the life cycle. It covers from 0 age to till death, and that's why we will find this at every stage, this particular scheme, and under the domain 2. And this in domain 3 starts from the life cycle stage 3, that is 15 years onwards, and Manrega is the one which provides this livelihood to this two set of in these two life cycle stages, and IGNOPS is the last one, that is pension scheme for the old age. So that is how we need to map at the very first step the different schemes in this LCDO matrix. And based on that, again in the next step is about framing the indicators. So indicators which was given while I was mentioning about the construction of the index were more general indicators. But when we are talking about the scheme specific things, then we need to be very specific about curating the indicators across the dimensions based on the intention of the program. So likewise, for example, adequacy, though it's in ICDS scheme, I have taken for adequacy purpose, I have taken the minimum proportion of minimum nutritional value which is being delivered by the program. So so what is being prescribed and how to what extent the program is particularly delivering. For coverage, it's again 0 to 6, and again as I mentioned that for coverage I am taking not taking that BPL line, because I had discussion with Professor Christian also on this, how to get this eligible population calculated, but that BPL line is always like may not always giving the right picture. So what I have done here is to take the last 2 quintiles. So each age group last 2 quintile population is considered as a eligible population, and then I'm looking at how this actually giving to what extent this particular population is being covered, which will give us the coverage. And for efficacy, we are looking at how this fund release for that particular scheme has been utilized. So similarly, for each of the scheme, for example, in health, in case of health, we are seeing what level adequacy and health, if we have to see, then we are just calculating the level of hospitalization expenses which are covered by that particular social protection program. So likewise, for each of this sub-index and each of this dimension, this entire in the state of indicators has been created, and this is the second step. And for each of the scheme, we need to do this so as to actually arrive at the final score. So suppose this is like just number of indicators, and more are repetitive, because in case of efficacy and coverage, it's more or less same. Adequacy only we need to tweak as per the intent of the program. Before coming to the final calculation, I just want to mention about from where this data has been taken out. So basically, for calculating any any social protection score, the usual sources of secondary sources, if you are not going for the primary survey or so, the secondary data would be like census data, which is quietly which is like available in most of the countries. Also household surveys and the administrative records which are available can be used for calculating or estimating MSPI in any country. In particularly in Indian context, I have taken the secondary data from the annual reports of the various ministries, various departments. Mostly is like Ministry of Statistics and Program Implementation. I have also taken the data from the UPI, which is the Planning Commission, earlier called as Census report, and our central bank's report taken. Some data points have been taken from the especially household size and other things I have taken from the census data 2011, because a new census is yet to come. That's the only thing. Otherwise, all these other things, other indicators, data for other indicators I have taken from the recently done surveys by the various departments, particularly to be mentioned are National Family and Health Survey 19 and 21. Then National Sample Surveys, a Key Indicator Survey on social consumption. And this NABARD is the Rural Development Bank in India, which conducts a survey on financial inclusion in 2016. And this from here I have taken this average consumption expenditure data. So again, some data where it's not available in many developing countries. I understand that this is the problem, that getting the data and getting the right data is problem. So I have tried to collect the data from the parliamentary questions, as well as we have something called as Right to Information Act. So I tried to explore it to some extent and try to dig out some information. Luckily, to some extent, I was like succeeded in that as well. So this is about the data from where I have pulled out for calculating this. So after this calculation, yeah, anyway. So if we put all the things together, in that case, if we see, we'll find this MSPI score as given in the last table. This particular portion which is in the green is like 95, had scored 95 and above. This score is out of 120. So every state, and top at the chart is the Uttarakhand, which is this state, the near Himalayan region on the north side of India. And again, this northeast state also has performed well in terms of coverage and adequacy part. So they are also ranking at the top. But surprisingly, if you see these three states, Telangana, Odisha, and West Bengal are at the bottom. So the reason mainly because these three particular states have not implemented the Pradhan Mantri Jan Arogya Yojana, and which is one of the primary scheme of under the study. There are some political reasons for not implementing, because India has this federal structure wherein state can take their own call whether that is the particular scheme launched by the central government has to be implemented or not. So because of that, this state's score in that particular scheme is 0, which is dragging down their overall score. But in case of this Telangana, they have recently adopted it, and from 2021. But the cutoff of this study is 2020, particularly because 2020 and 2021 is affected by the COVID, and I thought there is maybe the distortion in terms in coverage and adequacy, and even releasing the fund by the government also. So maybe a distorted picture might have come. So that's the reason I have excluded that 2021, and hence Telangana is not appearing, appearing as if there is this particular health insurance scheme is not implemented. So overall, if we see 2020 position as per this newly constructed MSPI, so we find that these three states at the bottom, and Uttarakhand and Chhattisgarh. These are the states which are at the top. This particular index also provide us to have decomposition, because here we are using that additive instead of multiplicative aggregation. So this help us in decomposing this particular index into the sub-index at the sub-index level also. Here what I am proposing is like what we have universal health cube. Here for this understanding and clear picture, and to understand the gaps where it stands in terms of the ideal social protection structure, I have here tried to make a social protection quadrilateral. So this is a perfect social protection quadrilateral representing 120 score on each of these sub-indices, and then contributing to the final score of the this multidimensional social protection index. So if I will not go through by state, but just will take the one example of one state. For example, here this elderly social protection index in terms of Assam is looking very far from the perfect score. So it means as compared to the other indices. So means in Assam needs to concentrate or focus more for their elderly social protection program, so that their score can be improved, which again ultimately will improve the overall score of the multidimensional social protection index. So that's the purpose of having this social protection quadrilateral. So I have plotted all the states. Likewise, here in case of West Bengal, you can see, because there is no one scheme is not available, not understanding is not there, so they are very small structure representing that they have a bigger social protection coverage or framework in place. This again sub-index allows us further decomposition at sub-indices level. Here the decomposition is done for each sub-indices at the scheme level. So we can see which scheme is contributing to what extent in that particular sub-index. So this is just a graphical representation of that. Here also you can see that Odisha, West Bengal, these are the states where there is zero contribution by this PM insurance scheme, and hence their overall score is aggregate score is low. So this is another indicator. Actually, this decomposition of this sub-index help us in understanding at scheme level also where the state stands. Another important and interesting dissection this index provides is about their in terms of the three dimensions which we have discussed. So here, if we see the scheme wise, if you do the scheme wise analysis, then we can find which state, which states are represented by the circle at the various points at the circle, and then this blue line is indicating the adequacy of this particular ICDS scheme. Orange line is indicating the coverage, and the green line is indicating the efficacy. So here we can see that for in case of ICDS scheme, so this Punjab, Rajasthan are the states which are having lower coverage, whereas states like Assam is having the higher coverage, and for other dimensions like adequacy and efficacy, more or less there is a uniformity. So this particular analysis provides us dimension level understanding also, where that particular scheme stands in terms of adequacy, coverage, or the efficacy. So I won't go by scheme by scheme, but yes, this is for each of the each of the life cycle phase. We can see particularly in this. If we see, this is very interesting one. I would like to highlight this Manrega scheme. If we see, the adequacy is very low. Is because the amount which is being guaranteed by this program versus the amount which is required or average for the average consumption or expenditure purpose is very low. So that's why it's not adequate enough to fulfill the need of consumption, average consumption or average expenditure. So that's the reason it's the score of adequacy for this scheme is very low, and you will find this blue lines is rounding near the 2.0. Similarly, these are these things. In short, how much time?
Got 15 minutes left, like for Q&A. So,
Okay.
if you
So
want to
I'll just wrap
some-
up this finding summary and then just couple of slides. If we see this findings or summary of this particular study on Indian state, we will find that out of this study is done on the 28 Indian state, representing around 98% of the population, wherein West Bengal stands at the lowest and Uttarakhand stands at the highest. From this score, also we can see that there is a variation in each of the sub-indices at the sub-indices level also. The mean value of the YSP, this Young Social Protection Index, is around 90.5. Whereas in case of Elderly Social Protection Index, the mean value comes around 79%, and which indicates that the range for this is higher as compared to the range for the younger young population. So even when we look at the various life cycle stages, we find that after evaluating dimension wise and the scheme wise, and the life cycle wise, we find that all the states need to strengthen their social protection program for the elderly people, because we don't have the adequate social protection programs which can take care of them. And again, out of this scheme, this what I already mentioned, these states are dragging down the overall score, and I think Telangana also started implementing the scheme. So this is about just findings, and to this sensitivity analysis also I have conducted just to check the robustness of the index which has been constructed. And here we can see that actually this population weighted approach I have taken based on the population of the age group while calculating. But here to check the sensitivity, I have given the equal weightage for each of the sub-indices, and the sensitivity has been checked against the population weighted index versus the equal weighted index. So more or less the results are coming like though there is change in the rank is not that subsequent as compared to though there is a minor changes in the overall score of the states. Lastly, to come about the conclusion and way forward things. So this application of MSPI in Indian context give us confidence that this particular framework can be applied in any jurisdiction. This may help policymaker academicians and to analyze the social protection programs targeted toward different set of age group in terms of level of benefit to be delivered, in terms of the coverage and the coverage of the potential beneficiaries, and the allocation and utilization of the resources. This again helps us in identifying the gaps, and this index will help us in regular monitoring of the programs, social protection programs, so that any improvement if we need, we can do that addition or refining, retuning to this program. Way forward is like this program I want to be conducted for all the schemes which are prevailing in India, as well as if possible we'll be doing the study for the applying this particular index on other countries, especially developing countries. So with this I will conclude my presentation. Thank you very much all of you, and special thanks to Indian Observatory and III, Dr. Ruth and Professor Chico and Professor Krishnan for providing me valuable guidance during this period. Also, I would like to specially mention Professor Sudhir Anand and Professor Parsha Kishore for taking out their time and helping me. And my colleagues also, Professor Wasim, Soham is also here, Professor Soham. So they also helped me during this study for conceptualizing and providing the guidance in this respect. So thank you one and all for being present here and listening me patiently. I'm looking forward some feedback and we'll improve on it. Thank you so much.
very much, Ashish. Okay, we have some time for questions. Maybe I can sit in a way that I can see people.
Ooh, there's lots. Okay, let's start there, then move this way. Okay. Oops, okay.
Yeah.
Should we group 2 questions? Okay, is that okay?
Yeah.
So we'll group groups of 2. So
already have a few of them. But first of all, thanks for the presentation. Very cool project. I really like it. A few things just for clarification, and then a few other follow-up questions on what you presented. So one question, I wasn't quite clear on your explanation of why the eligible population was defined in terms of quantiles, and you mentioned you had discussions around that. So I was just curious if you could comment on that a bit more when you were defining the eligible population for the various indicators. So what was the rationale there? I didn't quite understand why you chose 2 quantiles. Then on the functional form of the index, sorry if I missed this, but so I saw it was relatively separable for the programs and for the population groups. Now, do you consider coverage, efficacy, adequacy within each state, and then that's how you presented the state figures? Because that part I didn't quite get, or was it at the national level and then you somehow disaggregate? I'm presuming it's the former, but just to clarify. For the efficacy in particular, because what you're using is just the input of how much money is spent, right? So I wonder, isn't there a better way of doing this? Because there's probably very poor approximation of what's actually going on. No, I mean, spending money and achieving the outcomes that you actually want to achieve are probably 2 very different things. I was just curious if you had thought about this more. This is just the best you can do, which might be the case, but perhaps there's other things you've thought about or explored. So just be curious on that. And then the last 2 things, in terms of the interpretations, you've already mentioned that the federal system, of course, provides a challenge, you know. I mean, you only have national programs here that are executed or not executed by the states. But then the ranking here looks a bit misleading if you see Kerala somewhere in the very middle, you know, and they have a lot of social protection that is very efficient and effective in terms of achieving the outcomes you're interested in, but it's just on a national program, right? So if you derive policy implications from this, only from using the national level programs, you're a bit ignoring that many states are doing great work, just not within the national system. And last point, I think the sensitivity analysis, it would actually be great to do that also by exploring different weights for the programs. So now you're implicitly assuming that each of those programs for each of the population cohorts you're studying is equally important. I think that might be a bit of a stretch if you compare the qualitative importance of some of these programs that you fed into the index.
So there were 5 questions. So
sorry, yeah.
So I think I can address those first.
Yes.
So regarding eligible population that you asked, firstly, you know, this the way to identify eligible population. One way is to identify the below is to see the below poverty line population. That's a broader indicator which make us you know, understand which is the population which requires actual benefit. But somehow because those measures are quite older and to some extent they don't give the right picture, that's the reason this is 2 quantile approach has been taken, which is based on the recently done actual survey by the National Family and Health Survey, which was conducted. And that's the reason, because this actually, if you see at a broader level, this is the 40% of the population. And if I go by the below poverty level population, it's around 20%. So 22% to be precise in case of India. So again, if we design the program keeping in mind only 22% of the population, 18% population will be out of this, you know, away from this benefit and will not get, will not be seen as required, will not be seen as the population who requires the benefit. So just to avoid it and to see the, deliver the benefit to the actual population, this 2 quantile approach has been taken. Secondly, you talk about this aggregation about adequacy and whether it has been done about at the scheme level or national level, state level or national level. So each has been done at the state level only because this every data is available at the state level for each of the scheme. So everything is calculated at the state level, and then for each of the dimension, and that's how the state level score has been arrived for each of the sub-index, and then it was aggregated. Yes, to some extent, I'm agree to your point that efficacy, which here I'm calculating on the basis of utilization of the fund, may not give the right picture. That also I mentioned during my presentation. But if you see, in countries, especially in developing countries, there are a lot of leakages also, which ultimately results in not delivering the good desired results. But at least if government is releasing, for example, 10 million rupees for that particular scheme, that's a very small amount, I said. And if it gets fully utilized or if fully transferred to the intended beneficiary, to some extent we can, that's again a parameter that actually 100% output versus 100% input versus 100% output. So that's one thing, though I agree to your point that it may not be the exact represent the efficacy totally per se. But yes, we need to have something to calculate efficacy. So that's the dimension I find is like more relevant or more considerable. You again talk about the sensitivity of the thing, and if I mention, yeah. So sensitivity, yes, there are again we can use the here I taken only equal weighted approach against the population weighted approach. But yes, the weightage can be percentage can be different, can be very different. That have done that exercise also, but because the presentation has to be very precise here, so I just taken one example of equal weighted versus the populated weighted.
Okay. So now,
Sorry, I was going to say Tanya has her hand up online. Just
all right. We have 4 minutes left. So let me take these 3 here, quick questions. Then you'll answer, and then I'll take Tanya very, very quickly, and then that'll be it. So Julia, let's keep our questions quite short, please. Julia.
Okay, so I'm reducing my set of questions. First question is, can you do this at a district level? Will you have the data for basically coming up with a decomposition of the index for every single state, given that, as was mentioned, right, we have all the social protection program, which are not only managed at the federal level, but at the state level. And second thing is, I don't know where you stand in terms of progress, but did you present this to policymakers? And if so, how would you like them to use this index? Like, what would be the desirable outcome from your perspective of, I'm a policymaker, I see where my state is within the ranking. What shall I do? Shall I increase the score in absolute margin, or like, what would be the way
I
forward?
really like this question, being a policymaker. Back in India working for
You
so
have
can
to-
I address?
No. Let's take 3. Otherwise, we'll never finish. Let's go.
Okay, yeah, I really appreciate your attempt to be very comprehensive in your view of social protection. I was interested in if you found any nuances, like the one I'm aware of in the United States, where medical coverage for the elderly does not cover drug costs. And over time, drug costs have gone up. It covers hospital costs. And so elderly families are bankrupt by the price of medicines. And that's data are gathered annually by the US Census Bureau. So I just wonder if you found anything where the programs they appear to be protecting, but they're not protecting. That kind of thing.
So yeah, that's the reason.
No. Sorry, Ashish. We're gathering 3 questions. Then you'll come to you. George.
Yeah, Ashish, very good presentation. I liked the conceptualization part of it. My question is in relation to implementation. Like your life expectancy, you got children and education as a kind of, and you also see it like the protection activities included, midday meal and things like that, which, I mean, I have lived in all these villages in Jharkhand and Bihar and so on, as a researcher and as an activist. But if you look at, yes, there is a protection in terms of a midday meal, and we'll have to see how many of children are educated through that process. So if you want to really understand whether a social protection is effective, then you will have to see the literacy rate of that state. If you look at Jharkhand's literacy state, one of the, where a lot of indigenous populations live, the female literacy rate is 37%, and male literacy rate is 53%. So in terms of having a protection, if that doesn't implement and relate to really people getting literate, then that's very protection itself problematic. It is just for the sake of having a protection. That's what I think your question was also in relation to that. Similarly, healthcare in terms of, if you look at one of the states in India, Jharkhand, Bihar, and also if you look at specific communities like Dalits and Adivasis, their access to health is much below 50% even. So therefore, having a protection saying that, okay, there is this present there, but in terms of its implementation becomes highly problematic. So therefore, any protection needs to be seen in relation to its implementation, how it is having an impact, a lasting impact in terms of health access, in terms of education, in terms of employment. And it became very clear, especially after the pandemic, with all the laborers from these states like Jharkhand, Bihar, and so on, stranded in places like Delhi and other cities, because livelihood provided in the rural areas have not been adequate enough. That's why they have to migrate to the cities as laborers. Therefore, all these protections becomes highly problematic when it comes to implementing.
Those are very good questions.
Yeah.
They-
So I'll start with the last one. Last question. See, this particularly implementation part, I do agree. There are gaps in terms of implementation of this social protection program for that matter, any policy per se also, particularly given the democratic and the federal structure of the India. That's always be that problem will always be there. But at the same time, if you talk about the health access and all, with this particularly Jan Arogya scheme, which health insurance scheme, which provides completely, auto enrollment sort of thing is there, so that one need not to do the enrollment or any registration for that purpose. They can simply find their name in the 2011 socio-economic census. If their name is there, and then can definitely go and have the cashless treatment over there up to 5 lakh. So yes, second question was on that only, that whether that's adequate enough or not. So yes, that's why the adequacy of element of adequacy has been taken into account while as a one of the dimension while evaluating the social protection program. But yes, the final outcome, whether that literate, because of that program, how many people are got literate and other things, whether their school attainment rate has been increased or not. Yes, that definitely that can also be seen as one of the indicator or parameter to judge a social protection programs. And yes, I will take it as a suggestion and will try to incorporate how it can be taken into account into the index. That was actually I tried, but it was not some way was fitting in that index criteria. But yes, we can look into it and we can see how that particular things can be incorporated. Sir asked me about elderly population, whether that elderly population, the health coverage is good enough or not. Particularly the scheme which we have taken, as I said, it's provide the 5 lakhs rupees of health coverage. And here, if we see the hospital average per hospitalization expenditure, I have taken against it to arrive at the adequacy aspects of that particular program. So here we find that the average rural per hospitalization expenses is less than 1 lakh. And whereas this scheme is particularly providing 5 lakhs. Though I understand that in certain cases is maybe going up, but this particular 5 lakhs per year per house for any member in particular household gives enough coverage, enough adequacy to that particular family, so that they can take up their treatment in any of the hospitals. And again, the coverage from that point of view, they also have impaneled the private hospital also along with the primary health care centers and other government hospitals, so that again expand the reach of the health coverage or health treatment to the masses of the country. I think then one question was regarding that whether this program, madam asked me about, can be implemented at decomposed at the district level or not. Yes, it definitely can be decomposed at any level. if the state wants to accept this and implement it as a policymaker, for example, forget about India. India at a aggregate level don't want to, they are not taking this index to evaluate their own social protection program. Then any state also can take up, and then they can monitor district wise which district is standing where in terms of the coverage aspect or the efficacy aspect or the adequacy aspect. So yeah.
I meant in terms of data availability.
Yeah, data availability at district level would be like at some surveys they are doing at district level, but some surveys are not at district level. So the administrative data to first come, some schemes, some departments are doing it. They have that even district-wise data available on their websites also particularly. But for some scheme, the data is not available even at the scheme state level. So that has to be seen, and that's the constraint of this particular study also. So, but if the government or if the policymakers decide to implement it, they have all the resources to gather that data, and they can then actually implement and arrive at a final score. Though this scheme particularly, I have taken only 5 schemes, and as rightly said, if at state level also there are many schemes which government offers at a state level. So I am not saying that this is the right picture. The purpose of taking India as a study here is to see whether the index which I am proposing over here is practically implementable or not. So that's there. What point he raised is absolutely right. At state level also there are numerous schemes, and at central level itself there are more than 200 schemes in India which is taking care of the social protection. So I hope I have answered.
Thank you. Tanya, is your question askable in 30 seconds?
Absolutely. Thank you very much. Really interesting framework. I'm worried about the absence of a livelihood domain for children, for childhood, because we know that it's a period of life when poverty is very prevalent. I don't think it can be subsumed under the adult livelihood because not all adults have children, and it's particularly those with children that need livelihood support through social protection. So particularly when thinking about applications for this beyond India, it seems to me essential that livelihood for children is introduced as a further domain. Of course, that is arithmetically awkward because then you have 3 domains for children and 2 for other life stages, but I think the index must be able to cope with that. Thanks.
Yeah, this is a very valid point, and I find that in various countries there are livelihood support is given extended to the children also. Whereas in case of India, such livelihood support directly in terms of money is not that much that available at the central level at least. So yes, as you rightly pointed out, ma'am, this index in this index we can introduce livelihood or this income support for the children as one more dimension, and that's very much possible given that this additive nature of the index, and and even the decomposition can happen at even at the domain level. So yes, that's very much possible, and that flexibility that's index provide, and country-specific index can also be designed based on the needs and of the country and requirement of that particular country.
Thank you, Ashish. I know there are some other questions, but unfortunately we don't have any time left. So please follow up with the speaker and address them. Join me in thanking Ashish.